Good evening and welcome to Simpson at 8. I'm Lidhe Movono. Nearly 1/3 of all Fijians have type 2 diabetes, and the disease is often not caught until amputation or even death is imminent. On the show tonight, we look at ways that a local NGO is working to address this disease.
When you have diabetes, one of the biggest areas is to look after your feet. And the Ministry of Health is working hard in that area, that we examine the feet of everyone who has diabetes. Now on the flip side, why there is a lot of amputation is they do not control their diabetes and they come in late.
Many of the diabetic amputees we find didn't even know they had diabetes. So one day they go to hospital, they get cut.
By the time they reach us, to save them, we have to cut, we have to amputate the feet.
And when they get cut, it's a shock to the system that they have become disabled. It's a shock to the system that they have lost a limb.
Once you go to the hospital, get screened if you know you have diabetes. Simple things. When you wake up in the morning, normally we look at our eyes. We are saying for diabetes, when you wake up in the morning, look at your feet and get your feet sorted. That every clinic you go to, we have to check your feet, number one. But some still fall through.
Rondol kawan, awa takin na vangu, ama ni sang ni lako ibar ni bola, ni sang ni kila ni sa tawio itu kuna matin su. Yado na ngau na me sa lo me na nungui tau ku kunia vangu. Maui, oti au sanga ikau te bar ni bola. Nungui yado ni bar ni bola rasto sa kuna na bunuai ni sa tawio itu na matin su. Oti sama ni musugi kina na vangu.
Amila-mila nga na nungu tau kukule buniaba, sanga iwaka ya bubuza mai. Yo senikila ni na bubuza ya sa saranga mai na bangu.
24 मर के रहा था मैं जब से डायबिटीज पकड़ ली सला 2016 में मैं गोड़ कट गई से 3 साल हम व्हीलचेयर पे रहता 3 साल से व्हीलचेयर पे रहा
Au tone buki na vanua. Tavia au tone botitu. Wele morara o morina rotawa. Ni roi bodo mai ni tau koro en donan rau rosangabu. Dona lako. Ke lako listale ronan rau basangabu. Atamani la boli. Kone bon mai sa sang mai twiki. Meroni tolonga ro loko i ni bula. Lismai.
Au anda wakawele takatu na check up sana mendau check tak na ve ngau na sawati na randau ya vani na bunuai kena nasi na kor ya au mani sanga ni klakina ni sa tabio tu kona mateni suka sa tosu tu na musuni avani avangu me ado vasara mai na ruku ni ndurung sanga me musukina bondua ya do katalanga kina na koroni avangu andune singa wa zombara siko ni to kovate o tia ngani mbutu atale nei vapo wa da buto mena kovate amani vakatranga kina au seni kote wal nimbola au sanga tiunga ni wandi ni taka ni sa tobio na mateni suka au tia sanga me kote tale wal nimbola ngona sa lo tu kina na mateni mwa sama ni le muskina na vangu ena rugu talenga ni ndurung.
Ang nasalita rin kinanungunra, kauna sa doon kena tumbo na namunra. Sa ko serangan itu kutu ni biau. O cingana itu kutu ya sang talindo na ka itu ni biau na solimena kena buani kau sedaba. Na kena mazatara ba lelo tu. Andam bitu ke balo tu, o wakilani sa malu-malu na sangi mawi ke ngo metiko mena lingangu. Mekoto sumbu na bangu mawingo ya saranga na bangu rani sing rasarangan itu sakira mau darano gui baba Kau salamani le dhuru tu walimbula mendua na madhawa. O chinongo dhuru walimbula, o kau le stale mai vale.
We say in the NCT space there is no, the causes are known, but there are risk factors or risk behaviors that are associated with the disease. In Fiji, we talk about 7 risk behaviors that are associated with NCD. Now with NCD, we talk about blood chemistry. So we say these behaviors, they deal with chemicals which affect the chemicals of the body. Chemicals of the body which are the most familiar ones are blood sugar, blood glucose, blood pressure, anemia, blood hemoglobin. These are the chemicals that need to be balanced in the body. And the theory behind it is if you have a normal chemistry, you shouldn't be sick.
Ni oti ruana mba kina ruana ndolu tini kawalu, orto sambasi kamay na Friends. Orto kota may maguboni kau, orto kota lang may na dawani bako koyang na physiotherapist, ko sa may bako koyang tikinalaman ni Valengo. Au sarere sarang lebu na bisa o mantang abakata kiau, nunggu tikalaman ni Vale. Au sabakila sarang lebu na bileto koko telekina ngongu. Nangono ba koko yango au orto ba tuda kita kiau au sa taong bale tala lamani vale sa yabala tala na lingangu iau ba binibinaka ni sadakabe au eso na ba koko yango ni rani zabu yabaki na maudhuri tumba batana bona ni baka zengu na bona ni baka saba ni sisili tiko itumba kau marau taka ni sara ni zuru na matani katumba na rumu au tiko kina au sara ni nduri na itumba au hop taki au ya ni itumba mole baka zengu kale bas patake mo sisili kia.
You know how when we're running around normal and all of a sudden a situation changes for us, it's very important that the family members pause and think, what is the person going through right now and how can we help them? Emotionally losing a limb, because you always feel that the limb is still there, it's a big shock.
Nakena mai tege buve yau na matengo au asenga ni nama kabakandua. Mana ruana undolu tini karua au asakila arato satu na be yau na buniwai. Nio yau satu yau tiko na mateni suka. Ungai tuku no yau senga bakandua. Palte senindua na nito bubale tege bu mena nongo forefathers me adob yau. Senindua ya tau bi mateni suka. Senga bakandua. Sini bakambauta 2012. 2015 Ucia sangga irai di saranga be yau. Amila-milanga na nungu tau kukule buniaba. Mila-milanga au mila. Mila sangga ibaka ya bubuza mai. Bubuza ngamai nakani mila-mila. Yau seni kila ni na bubuza ya saza saranga mai na yabangu. Rista lebal nimbula ngagale tukuni be yau na yabangu saza sando donu ngame samus. Au ngai tanya usintali ta kasaranga bakandua. Au sini binakata mbese mesel na yabangu ya. Sambo itu mantangan ya bangu ni sama buatu. Ocia ulesta level ni bangu sa sini bosotara wana mosi botakena kena imboi. Osa nanu mireto na nango bobale. Osa mani bagayo takanga me usala ko melai mus. Asa man lei musar na nango tau kukulebu. Ocia mo itiko ani bale. Ngauna saranga melai mama da melai binaka kina ya bangu ya teke butale ne karua. Oh saranga wararawa takasaranga na matengo. Sanggai kasi bagi ciko main na radio na matengo na mateni kana baka ve Italia. Iki au salei malumu au sabangan dina taka nyoya wendo anandau kana tu baka ve Italia. Akanga ka uma yau kania. Ke boy nambongi me mataka au kana nga nungu ndau vina kata tu na kakana.
Eating is a sign of life. So you need to eat to live. And very important. But the issue in Fiji is that yes, we need to eat to live, but it's the menu that we are eating that has changed. We have changed from processed foods, and the latest study that we've done have shown that we have shifting to the supermarket foods or the processed foods.
Mauna sa musu na bango sangai bisa utakana nongo kana. Au sanga ikania tu na kakana raun kwa na kakana nondo ni meua kanianga ina mateni ngauna atukuni kina veiau ni satovio tu na mateni suka. Wasa azana lenga au sanga bisa utanga na kakana au sanga kania na kake venga ite asani vale. Waki laikia na nungu mbula binaka kauko binaka na ngongu au rawata na katozo kwa wasa mai yalana tu zuki were arato kilati kona nungu vale. Onda ngwana nungu were me tina kaloko me azo dua se ngaune kata kina singa. Ya ubaka bina kata kaya exercise onda zakaba.
Ndau mbalavu nungu ngauna tu ni lakui laurai balimbula mena vidana bula. Ia waka bina kata kabiro to na friends ni to ndau duru mali tu mai na mali wa ndau tigo ya ruana madhawa artonga ndau ya mai. Ia ndau marau na ya longu mena nungu sa matigo nungu bondo libia ni di balimbula arto la kutigo mai lo maya me tauri nungu pressure tauri nungu suka au exercise taki na pakasala tau dogo ni kakana na veka tau dogo mi kania mi wakatambuya erto talinga nungu vitama erto tokoni ya wakali bu mainan erto ndo ngole mena friends sa libu na kakana kitu sa wakatambuya sarata te ngai lo mani nungu bu vale ya mena nurto vitokoni kau nungu vitaman metandana ka erto tuguna tiu veiau nirto toko na bakalibu nurto ndo lau mena friends kina nungu mbula baleta erto maruta kan erto raidi nurto nati ko nimbula binaka ka kitu maruta kati oni tumbula na vi ngau na tau dok.
To prevent diabetes, you have to control the sugar and look after your feet. Now, for those who have been amputated, that's not the end of the world. You still have to move on in life. The end of our world will come when your heart stops. So even with amputation, you can still live long. And one thing I like about Friends is they come and help them, try and mobilize them, do the simple things. Go to the bathroom, go to the toilet. That means there needs to be a change in the way the home is built so that the Fijian can mobilize himself or in the house.
I've seen one family member, he has 2 older people and he's put railings all around the house so that the older people could hold on to the railings and don't fall down. You know, it's aided them to get to the toilets and showers.
And do some food gardening. We've done some of that before, where we have encouraged amputees to plant home gardens where they could eat it and also sell when they have plenty.
We got into the community, we do home visits for people living with non-communicable diseases or disabilities caused by non-communicable diseases that have been discharged from the hospital and currently at home. So far, out of the 60 patients that we were seeing, most of them were chronic patients, meaning that they were being discharged from the hospital and they've been at home for more than 2-3 years.
We found that most of them are just left on their own. They are crawling around and there's no one to attend to them.
Nanunggu tui bale. Siang na nito bale lima na nga chiku sarmai sana ya. Yo siang na wheelchair be yau. Nanunggu zakadanga yau sandu sanau norto sandu feda merto nunggu matu bale. Norto kebete chiku bale lai. Nakangandu zakaba saroni dek takiau nga roni ngasing ike balilay sara.
It's a reality in the communities, but somebody has to do something to look after them.
Yo babinam na kana numtu buke umerto na Friends na katang mena nungu wheelchair babina na numtu bebuke na numtu dakapsan nungu balilay balsili. Pasabol le kasar chungo beyau. Au babina na kabirto na Friends ya. Na nundu to bebu ketu na nungu ngangandre lalai.
And also we try to encourage them to be part of the community that they were once a part of. You know, like sometimes when you had these amputations, when you come back from the hospital, you are left on your own. You feel stressed out, depressed, sad. There's a lot of things that going on in their minds that they themselves only are the ones who are able to tell you.
Sa raila katungan nung bakasama. sa tukuntunga sa senirawa na sa basamataka tunga na mate sa sindatana ka basamataka sa basamataki nungu papa tunga se kalelai wadi mengaraba yo babinamnaka ni chiko na bibuke ilo mani vale tona friends
o ya wiliwan daw nga si kay tumba daw di udra singa takata ano kanong marutak sa rumah tali tu dapat ni sini minaka kena balik ni buah orang tata tu dah balik ni sini pada lain saja kongko ya saya ni teraya bantu nangaun aku bukan benda balik pun nak keluar itu na friends itu televisi umai.
With that, we work with these village health nurses, the Turani Koros, to ensure that we lift the standard of living that they are in.
We worked with 60 people and gave them some mobility aid, but we realized that they needed more than just mobility aid. So we developed this program where we've hired physiotherapists and medical officers to go into the communities where they get examined, because we discovered that some people, when they get disabled either by stroke or amputation, they have been bedridden for years and they don't go back to the clinic. So we wanted the doctors to first of all assess them. Then we very grateful that we have a physiotherapist with masters from Japan, a volunteer, who has worked with the local physiotherapists to assess these people. And over the years, we've seen marked improvement in the mobility. And for that shows, if we think about these people living with disabilities, very small interventions or very low-cost interventions actually can improve their lives, the quality of their lives. And that's crucial because you cannot have a person bedridden for next 20-30 years vegetating.
Ngauna se mernisele ki na me ada mai ba ndo toto bi mati tunga na venga una taudo awadila na singa se batam-batanan ra ki seda oya ndo batam-bata tunga na venga una taudo ndo musi tunga na ulungu ndo ulili wa tunga ndo lebuna ndui matangali mate ndo ya do via tu Maina ngauna selo tikina na avang orto vengkara bitu kina nungu matabu vale kina nrotondo la umena friends ali tu bagando na tawi mate taudo me adava mena singa ni kuwa bosa tu kinango.
If there is a message that I give to Fiji, you need to go back to the farm and eat organic, number one, because every Fijian is living on land. There must be something on the land that we are living on. We need to promote that one. But at the same time, we need to talk about the processed foods that Fijians have moved into and how we can learn more to eat from that.
Despite all the conversations, we don't see a change in behavior largely. If you see any morning tea, any food gathering, we still see a lot of cakes and pies and fried foods. And it goes from top to bottom, whether it's government departments or international agencies or church functions. Unless the leaders make a decision, okay, we'll allow one fried food maybe or one sweet dish, but not the whole table is filled with fried foods or sweet dishes. Any meeting, if there's no fizzy drink or very sweet coffees and teas or, it's just not a function. When are we going to pause and think, this is what's destroying us? We have seen people in late 20s amputated. So if you go by what Dr. Tukana says, the NCD advisor, if you have a chronic disease, because a disease like diabetes doesn't show tomorrow, it takes up to 20 years. So if somebody is getting amputated at 28, they were sick at 8, that means they were being fed the wrong foods from childhood. And this is what we're doing right now. We're putting wrong foods in the children's mouth, and we're going to make them sick in 20 years' time and amputated. This is the first time in our lives we see older people living and they're burying the dead children, young. And it's something that the VT as a whole needs to pause and think, and we can turn the tide around, because we are told by an NCD survey, first one that was done in 1983, the indigenous population did not have diabetes. And they were eating much healthier food because we're surrounded by good food. The National Nutrition Survey says 80% of our children below the age of 2 are anemic. Almost 50% of Fiji is anemic, but we feed our mouths 3 to 5 times a day. So we need to pause to think, what are we eating? Are we eating the good food that's around us? If we're eating the roro and the seitan and the boiled fish instead of over-frying everything, we probably will not get into this disease phase. And we need to pause now to change the tide around. We've seen 6 months intervention, 8 months intervention by a physiotherapist has mobilized these people. They can go back to their gardening, they can go back to fishing, they can, get their life normal. And I think many more agencies need to get into this to, one, uplift the people who are in the bad space right now, to work towards preventing it. And I think it's beyond urgent action time. So this was our attempt also to show people that 3 people being amputated a day is not a statistic. It is human beings living in amongst our own communities, suffering right now. And you and I can make a lot of difference.
It's our diet and it's killing us quietly. The key is right here around us, or rather in what we put in our mouths. That was your show for the week. Good evening.